This edition of PH in Person features the University of Cincinnati Medical Center and a pair of its leading experts. Dr. Gene Elwing will cover best practices for treating portopulmonary hypertension, and Dr. Shimmel Shah will take you inside the intricate challenges this disease creates for patients needing liver transplantation. Dr. Shimmel Shah, Dr. Gene Elwing, thank you for inviting us here to the University of Cincinnati Medical Center. Thanks for having us.
Thank you so much for being here. It's so exciting to be talking about pulmonary hypertension with you.
Great. So let's talk about your specific departments. Gene, let's start with you and talk about pulmonology.
So thank you so much for joining us. It's such a pleasure for you to be here, and I'm so happy to be talking about portopulmonary hypertension with Dr. Shah today. I'm going to introduce you to the University of Cincinnati, and Dr. Shah will tell you more about the transplant program here. So we have a lot of firsts at UC. We were the first medical school west of the Alleghenies. We were founded in 1819. Also, we were the first hospital founded for teaching purposes. So we have a long-standing history of focusing on teaching and education. So in my division, the Division of Pulmonary Critical Care and Sleep Medicine, we have 31 faculty. We have researchers and clinical physicians, and we really have a focus on teaching, education, research, and advancing the field of pulmonary critical care. Importantly, we staff 3 major hospitals. We staff the hospital here, the main campus hospital, University of Cincinnati College of Medicine and the Medical Center. We also staff the Veterans Hospital, as well as our hospital in the community in Westchester, Ohio. So we try to serve the patients in our downtown community, as well as those out in the suburbs. So we have a lot of different things we can offer patients. The things we really are good at and what we pride ourselves on is offering to the community things that patients need that we don't want them to have to travel 4 or 5 hours away. We want to be the person that answers the questions and delivers the advanced care in their backyard. We have a very robust interventional pulmonary service, so patients with advanced cancers, advanced emphysema can get those high-end intervention techniques right here in Cincinnati. And the other focus we have is rare lung disease. We have made huge strides in many rare lung disease. My division director, Dr. Frank McCormick, has changed the face of lymphangiolymphomatosis. We've gone from a disease that was nebulous affecting young women to a disease that has a treatment, all because of the work that has been done here. And another gentleman who works in our division, Dr. Trapnell, has done the same for alveolar proteinosis. My focus, of course, is another rare lung disease, which is pulmonary vascular disease. And we try to advance the field in pulmonary vascular disease through our work in clinical research and collaboration with great other services like the liver transplant program.
Dr. Shah, let's hear about the transplant program here.
This is a historic transplant program at the University of Cincinnati and was pioneered by Wes Alexander. And we did one of the first liver transplants in the country 50 years ago. We've had 50 years of transplantation, doing breakthrough treatments, and really coordinating care for the whole region of Ohio and part of Indiana and northern Kentucky. We perform liver transplants, heart transplants, and kidney transplants here, and also do pancreas, and have a comprehensive medical care for our patients. In liver transplant, we have one of the fastest growing programs in the U.S. Since 2012, and that's all based on a multidisciplinary specialized team that really guides patients from diagnosis all the way through workup, through being on the list, and then eventually getting transplanted and doing well years and decades after a transplant. And that's done through collaboration, not only clinically, but looking at innovation and research and kind of combining all the strengths that are at the University of Cincinnati.
So we're here talking about pulmonary hypertension, but there's a lot of other complicated medical matters. Talk about the importance of your 2 programs working together, especially in a surgical setting.
One of the main diagnoses that patients develop liver failure from or have along with liver failure is pulmonary hypertension. And as an abdominal guy, I don't know anything above the diaphragm or in the chest. And this is a complicated disease where patients have essentially high blood pressure of the lungs and they can't undergo surgery. So we really need collaboration with people we trust to see them for weeks, months, sometimes years before they're ready to come to the operating room and have their liver replaced. And that's not something that we can handle. We need experts that are in charge of pulmonary critical care and lung physiology, and people like Dr. Elwing, who basically take the patients and basically get them ready for the operating room.
Dr. Elwing, your thoughts?
First, he's being way too kind. He understands a lot about this condition, but the collaboration is essential. When patients come to me, I find they have liver disease, I find they have portopulmonary hypertension, and then I will be starting the workup and getting them ready to be sent to transplant for an evaluation, and vice versa. When patients go to transplant, they're screened, assessed, and when there are signals for pulmonary hypertension, they're sent over to me to evaluate and determine what is the cause of the pulmonary hypertension, and I treat as well as I can to allow them that opportunity to be transplanted.
So we're not talking about a luxury, we're talking about necessity here.
Absolutely.
Necessity for the patients, and I think over the years the collaboration has become so strong that if she says go, we go. If she says no go, it's a no-go. But there's been the experience now over time in our program where we have a good sense of if someone's ready or not.
I know she has that effect on people when she says no, that's
That's
it.
it.
We stop. So I'll stop there. Thank you both.
Thank you very much.